Oh shit! Hey guys, what's going on? Welcome to the Tills4Thrills podcast, where we talk about current events and life and everything in between. We are two veterans who decided, we have people important enough to us that we're gonna discuss stories. We're gonna discuss topics of interest. We're gonna take hot takes and everything like that. So if you like what you see, you can go ahead and email us down below at the Tills4Thrills podcast at gmail.com. If you have any questions, comments, concerns, you can go ahead and send that in. If you have a topic that you want to hear as a fan or as an audience member, you can let us know. You can also follow us at our socials. We have Rumble, Facebook, Instagram, Twitch, X, all the good stuff. So without further ado, I'm Julian Tiller, aka Tills4Thrills. I'm going to throw it over to my beautiful co-host Nick Straub. Everyone.
Hey, how's it going, guys? Welcome back for another episode. We're super excited to be able to bring you guys this content. Hopefully, you guys stay tuned for the entire episode. We're gonna be going over a lot of very interesting topics. As always, as previously stated in other episodes, guys, if you're a veteran in need or you're having a crisis or a situation and you need help dealing with it, you need to talk to somebody, go ahead and dial the Veterans Crisis Line down here, dial 988 and press 1. Other than that, I think we're going to snap back to Julian, aka Tills4Thrills, and we're going to go ahead and introduce our guest for this episode.
Yeah, for sure. And I'm going to leave the unmuting to you, Nick, after I introduce him. I am super stoked about today's episode because not enough people, I feel, are talking about it. So back in 2019, the end of 2019, I remember on the news, it was all over the news. We had COVID-19, right? And we had just people going, oh, it's a hoax, or oh, it's this, or oh, it's that, and it's not real, it's fake. Well, let me tell you guys, COVID-19, the virus, is very real. And we can get into numbers and we can argue how deadly it was versus the flu or versus X, Y, and Z, and that's fine. It's not to discount the fact that it actually happened, right? And when it happened, we were wildly unprepared for it.
Wildly.
And I don't know if that's because of hubris or if that's because we were just like, oh, nothing can kill us, and whatever. So it was definitely kind of a wild time to be alive, especially whenever like you get a sore throat and all of a sudden everybody's sticking shit down your nose or up your nose, and
Yeah.
touching your brain and saying squiggly, squiggly, squiggly.
Yeah. Here, just try to relax. And
Yeah.
then they slam that thing into your sinuses, and you're
Oh
like, oh,
yeah.
nice.
Well, hey man, so today's episode is going to be delving into the realities of being in the hospital. And luckily today we have a couple of registered nurses who survived the entire time. And we're talking, not only were they working diligently to save lives, not only were they in the thick of it, but these are people who survived traumatic experiences within that time. So without further ado, I'm going to go ahead and introduce, we have Tina and Glenn, both registered nurses.
Hi.
Hello.
Hello, how are you guys? Tina, do you want to introduce yourself first?
Pretty good. Well, I'm Tina. I'm a registered nurse and here in Michigan, as well as my friend and partner from work.
There you go.
Hi, I'm Glenn. I'm also a registered nurse, a retired registered nurse, retiring after 28 years in an emergency department, also in Michigan.
Okay, that's awesome. So, Nick, I'm going to go ahead and take over real quick. Oh, never mind. He's got it. So, before the show, we had emailed each other back and forth, and we started talking about some stuff that we were going to be discussing throughout the show. And I think one of the big things that stuck out was safety equipment and shortages, right? So, we want to talk about the availability and effectiveness of proper PPE, right? So we're talking masks, gloves, scrubs, the whole shebang. Because I remember that during the peak of the pandemic, I was considered an essential worker while I was in the military. We were supposed to run missions for humanitarian efforts, right? And that was the idea behind it. but I was obviously in a whole different state. I was in Texas, and we sat out in a motor pool all day by a truck, just waiting for a phone call, and that phone call never came. So I'm wondering if it was just maybe because it was like different geographic locations where it might have hit harder than it did with us. And I kind of want to get a feel for what that was like for you guys.
Go ahead.
Well, I can't account for what you did with on the military side, and maybe they had you kind of stationing in fear of once they started shutting things down, potential, just the fear that was coming out and potential looting maybe. From our end and going into like safety equipment, we kind of heard as it started coming through the nation. We started hearing how it was affecting hospitals and coming up our way. From a management perspective, we then started reaching out to other facilities, trying to kind of gauge where the usage was, where to get supplies from. Initially, our leadership team had told the nurses, don't worry about this. This is just like the flu. You don't need to worry about it. You don't need to wear masks because it's just like the flu. And we don't want to scare any of our customers, the public.
Right.
And I think
so was that like was that like I guess people would come in with certain illness or ailment, and they would just be like freaks, like just super freaked out because y'all were either in mask and gloves and everything and dealing with everybody, or like the I'd imagine biohazard suit with the whole headgear and everything, but I mean obviously that wasn't happening.
Well, that's exactly what the company feared, the company that we worked for, and I'm sure every single hospital around, because if a patient or family comes in and they see you all masked and gowned and gloved up, they're going to wonder what's going on, and they didn't want to spike the fear in people. Now, once we were actually in the peak of the pandemic, getting the equipment wasn't hard. But at the very beginning of it, they would collect our mask every day and go sterilize them. And we had to use the same mask for 3 days before we were allowed to get a new one.
3 days?
3 days.
Well, with the variant of unless it was ripped or soiled.
If it was damaged, then sure.
Yeah.
But then what happened was the employees started going out and buying their own. And a lot of that occurred, and we would share what we could get. And so that worked for a couple of weeks as well. And then what happened is they were nowhere to be found. We had cleared them all, all hospitals, all healthcare workers had already cleared Amazon, so they weren't available there. All stores around, they weren't available. Like Lowe's, Home Depot, Menards, you could go there and buy them in the paint department.
Right.
But those all got wiped out as well.
Well, I seem to remember during the pandemic, it was really hard for us. So I remember right beforehand, right? We had gotten sick with like a specific type of E. coli kind of deal where we had to disinfect our entire house. We had to separate one another. And it was kind of crazy because you think about that, and we had already started taking steps to disinfect everything around us. And the pandemic happens. And now we're just like, oh, come on, man. And so now we're reaching and grabbing for everything that we can because we're like, hey, man, I don't want to get sick again. That shit kind of sucks. And now you can't. Not only can you not find the mask, not only can you not find the gloves, not only can you not find the disinfectants, it just became really super crazy. So what were some of the things you did to circumvent that process where it was like, hey, if we don't have access through consumer goods, how can we succeed?
One of the things that I want to bring up about it first is when the patients first started coming in, we didn't know what was going on. I mean, we'd have people come in and their oxygen level was horribly low. We'd wind up intubating the patients, not knowing that that's what the patients had. So there were employees that got sick and some that even died.
So just a quick question. That being said, right? So did the hospitals initially tell you guys kind of what was going on, or it was just kind of a trend that you started seeing and then the hospital eventually kind of released a statement?
I honestly don't think the hospital knew. You see that a different way, huh?
I think their perception, because of how it was initially thought, from like the CDC and everything, they didn't want nationwide panic. And so our leadership and many hospitals that followed, truly believed in that, because that's what we were being told. So did we see a trend of this starting to happen? Yeah, because you saw the numbers, you saw people starting to get sick, you saw how it started coming up from the bottom states up towards us. And especially the East Coast got hit really hard.
Right.
And so then as people started getting sicker and we started getting droves of people, even the testing that they were trying to do.
Took days at first.
Yes. It took sometimes like 5 days.
5 days to get the
come
results.
back to get the results to say that, yes, this person is COVID positive. So it was really difficult to try and manage and figure out, even once patients got admitted, even if they didn't get intubated at first, where are we placing these patients? And, you only have so many private rooms in a hospital. So, you would place somebody in a private room. It would take you 4 to 5 days to get the results. And then if they were not COVID, well, then you could shift them out to a semi-private. But in the meantime, you might have a patient that didn't have respiratory problems that they put in the semi-private room that then started developing difficulty breathing, cough, that they were then testing. And it was just, it was very difficult initially to get a handle on just how many COVID patients were coming in, because it took so long to do the testing. It took us quite some time to actually get the rapid tests. And so on the vaccines, a lot of times, what the boots on the ground and the registered nurses on the floor didn't see from a management end was them scrambling and correlating with other facilities and bigger universities, and how are you getting your tests back quickly, and coordinating with the lab to try and get the tests to turn around quicker, and what do we need in supplies. And in the background, we're working with other companies of where can we get masks, where can we get the gowns, and eventually we ended up getting, even probably 2 months into it, we ended up getting huge rolls of gowns that were,
oh my God,
cheap and impossible.
Cheap. You felt like a walking garbage bag, because that's what you were. But what I can say on a positive note, hey, we came through, we provided, because it was very, very important to us to try and keep our nurses as safe as possible, even though, yes, in the beginning, I don't agree on a personal note, I'm not going to speak for management on that end, but on a personal note, I think we kind of were behind the ball when they were like, no, this isn't anything big. You don't need to wear masks and gowns and gloves. But once they started seeing the trend and realizing, focus shifted on, how do we keep our people safe? How do we care for these patients? And nurses, like Glenn said, and not just nurses, the whole hospital, we're being exposed, from our EVS staff to our cart distribution, to
cafeteria, everybody.
workers. I mean, it truly, involved everybody taking precautions, and they were getting sick. And then they had to, the other management side was, how do we deal with multiple staff members getting sick? And then how long do we quarantine them at home?
So I do have a question.
Sure.
And oh shoot. I'm going to preface this by stating a couple of facts, right? From this is coming from CDC, the CARES Act, and stuff like that, right? And I'll go over the facts first, ask the question. So we do know that as of June 1st, 2024, there's 1.4 million reported numbers that indicates direct deaths caused by COVID-19, right? Now, with that said, hospitals had incentives to diagnose, right? So it says here, the CARES Act of 2020 provided higher reimbursement rates for COVID hospitalizations, words Julian's, think. Medicaid or Medicare paid 20% more for COVID cases under public health emergency, and ventilator use increased funding even more, right? So then you get into like overuse of COVID-19 tests and false positives. So the question really is, how many of these were maybe misdiagnosed and mismanaged and considered COVID related before they were actually like, all right, cool, maybe we could have done something a little bit differently to save a life?
Let me start out by saying, do I think there was some that were misdiagnosed or maybe thought to be positive that really weren't? The way that I looked at the COVID test is just like a pregnancy test. You can't be a little bit pregnant. You either are or you're not.
Right.
So if you had a positive test, you were positive.
Right.
Now, do
And
I
our
think
chest X-rays prove that
right?
As well?
Once you had the shattered
X-ray.
glass chest X-ray, we knew.
Right.
I mean, we didn't have to have a test.
Yeah, before we even got any labs back, really.
Right.
Even the chest X-ray would.
Well, so I mean, to argue the fact, right? during the pandemic, I got strep throat, and we're talking about the whole 5 days it took to get the positive test back. I quote unquote screened positive for COVID. I didn't have it, right? And when I went to the hospital and they were like, "Hey, let me pick your brain real fast and shove something up your nose," I told them, "No, dude, like I have strep throat. I know, like I get it every year around this time. Like just swab my throat and then you'll see." And they like insisted. And I said, "Dog, like if you don't listen to me, I'm going to start swinging on you." Mostly because I don't like shit having, going up my nose.
Well,
and it had nothing to do with like me being disrespectful towards medical workers. It was just like, I told you what's going on. If you just do this before you do something else, that's fine. And it's not that I saw it as a hoax or anything. I knew it was very real. I've seen people who got COVID. My grandma, for instance, still to this day can't smell or taste. It was just a matter of, hey man, like I've been through this for 30 years now. Like just swab my throat real fast. And they were like, "No, dude, this is what we're going to do."
Go for it. Go for it first.
I don't. Okay. So like, I don't tell you how to do your job, so to speak.
Right.
I mean, let's be real. It was so rampant that it was truly for your safety, because there were patients that didn't have signs and symptoms that turned up positive, that felt like, or maybe they just had a little bit of fatigue. They would have never thought that they would have had COVID. So because we were seeing so many coming in, it's to protect you, and it's to protect me and everybody around you, because it was so contagious that wouldn't you have felt horrible if you would have been like, no, don't do that. I know it's strep throat because I've had it before.
We had people do that.
And hey, you're going to treat me for strep throat. Now I'm going over to grandma's house to visit with grandma.
Yep.
Right.
And guess what? Grandma is in her 80s, not in such good health.
Yeah.
And now you have just passed that on to her, and you may have not had any symptoms
Nothing
at all.
but a carrier. Yeah.
And
like
now-
asymptomatic.
So that's why they were pushing that on you.
And I admit, when it first started, we used to have to literally swab the base of your brain
Yeah.
to do the testing. It's not that way now. And sure, it was a horrible test. I will admit that 100 times.
Oh yeah.
But it was honestly to protect the greatest good for the greatest number. It was to protect everybody you would come in contact with, not just you, not just me,
Right.
but the entire population.
And your
And-
family.
right, and your own
because we saw
family.
families coming in sick
And-
because they were all,
Part of the big issue is the last time that the US had seen any kind of a horrible pandemic was in 1918 with the Spanish flu.
Right.
We haven't seen one
Like
since
this
then.
one,
You can't tell me there's anybody, or not many, alive that were around when the Spanish flu was here. We had no idea of how to deal with a pandemic.
Right.
We were in the hospital that we worked at. We were honestly more prepared for the bleeding issues that came from Africa than what we were this.
Yeah.
We had
Right.
already put up walls and all kinds of stuff for that in case it got here. But we weren't ready in the least for what
Right.
this pandemic brought.
So a quick question for you. With that being said, were there, obviously, right, like COVID had a multitude list of common symptoms, and you guys mentioned the shattered glass, fiberglass looking X-ray,
Mhm.
chest X-ray, with certain conditions or symptoms, I should say, with certain symptoms that were coming into the hospitals. Were you guys just immediately banging out chest X-rays like it was nobody's business, or were there a certain
Well,
type
you-
of symptoms that you kind of knew were more towards like when somebody walks in, they're like, well, I'm super tired. Were you guys going COVID, or were you just like, let's do a chest X-ray, let's see?
Eventually, it got to where we were doing the COVID test right out in the triage. I worked triage frequently because I was the person in charge in the department.
Right.
And since we didn't have enough workers because of the pandemic, then I would work triage as well. And it got to where we just do the test right there if you came in with symptoms that could be.
It could be.
And I mean, it could be if you stayed up too late the night before, you've got a symptom, you're tired and
Right.
lethargic.
Technically.
So, it depends. But again, it was to do as much as we could to save the entire population at that point.
Right.
So to answer your question about go right for the chest X-ray, absolutely not. We saw more testing, like he said, right from the get-go in triage. Obviously, if you were coming in short of breath and having those type of symptoms, and we saw, oxygen levels were low, then absolutely the doctor would say, let's not only COVID test, but let's get a chest X-ray.
So going back to it though, getting back to the initial question, right? And obviously I feel like we didn't know. So going back to what Glenn had said, we were wildly unprepared.
Oh,
We had no idea what was going on, right?
right.
It just kind of hit us like a
Yeah, hit
brick
us
wall.
fast.
And so I guess not necessarily just a misdiagnosis factor was going on, but you also had underlying conditions that amplified the effects of the negative impacts on the human body that COVID presented, right? So what would that have looked like, right, if we knew how to deal with the virus as well as the underlying conditions? And how many lives do you think, well, not how many lives, but like, how do you think that would have impacted the life-saving procedures?
Well, obviously, anybody who has any kind of respiratory issues, asthma, COPD, if you're really young, you're really old, those people are going to be impacted the most and the hardest. Diabetes, obesity, all those things.
Immunosuppressed.
Yeah, all of those things contribute to getting sicker faster and picking up things even a whole lot easier than other people. Like, even though I was a fat smoker, I was lucky enough that I never caught COVID.
Oh, dog, let me tell you, packing a half a day when I was in the Army.
Yeah. So,
Yeah.
you know, sure, there are things that impacted certain people, but in triage, like I said, I work triage a lot. And in triage, there's something that we always follow, and that's ABC, which is airway, breathing, and circulation. If your airway is plugged, you're going back to a trauma room immediately to hopefully clear your airway. If your breathing is not proper, you're going to go back and get intubated. And if you have circulatory problems, in other words, if you're bleeding out, obviously that's an issue. The fourth thing is D for the neuro status or disabilities. And that's the way that we follow. A, B, C, D is how you get taken back into a room. Now, you know, if you're having a heart attack, sure, you're still going to be first back because that's a circulatory problem. Because your heart quits working, you're going to die.
Right.
But we always followed that.
I do want to get into also the use of ventilators and how it eventually became a detriment, because I know we had discussed that a little bit. And you know, was it like people would come in and you just boom immediately put them on a ventilator, or was it kind of a progression thing?
Well, initially they didn't really know how to go about doing things.
Let me take it from an ER standpoint, since that's where they came in.
Yeah.
When a person comes in, if you're having difficulty breathing, okay, we'll throw you on oxygen.
Right.
But when these typical pandemic patients came in, it's not that they were just having difficulty breathing. You could tell they were blue. They needed oxygen and they needed it bad. And you check the oxygen level with just an SpO2 monitor on the finger and find out that their oxygen's 82. That person's going to die if you don't do it immediately. And this isn't an hour thing to try nasal cannula and see if they're going to live. No, you intubate right then and right there to save their life, because that means ABC, their breathing isn't working. So yeah, ventilators were used a whole lot in the beginning when we found those kind of things. Certain people would come in, their oxygen level be 88. Okay, we're going to throw you on 3 liters or 6 liters or a venti mask or something like that, just to see if we can bring your oxygen level up. Quite often they would still wind up, as the disease progressed, they'd wind up on a vent anyway. And you said that, you know, were they overused? We found out that, well, let me back up a little bit. Were ventilators overused? Absolutely not, because we had to ship in ventilators from other places because we didn't have enough ventilators in the hospital to take care of the patients that had to have the ventilator at that time. Now, later on, we did find out that not everybody had to be put on a ventilator, and we used a machine called a V60. I guess that's the best way to put it. And it's to where you're on a mask instead of a tube being jammed down your throat and you having to be knocked out to where you had no idea of what was going on. And we could use the V60. So yes, we found out that the ventilators were not the best choice. But in the beginning, when a patient comes in and their oxygen levels 82, and we even saw them in the low 70s, there's no choice but to ventilate that patient with intubation.
Right. So it became like an emergent thing.
Yes, exactly.
Our pulmonologist, you know, probably about a good month into this, after the huge surge, you know, end up kind of talking with some of the other intensivists and pulmonologists out on the East Coast, and found that it was better to start out like, you know, humidified, you know, oxygen, and moving up to like V60s first, to try that first prior to, you know, intubation, putting that tube down their throat. But again, it's, you know, healthcare is ever evolving. It's ever adapting and, learning and figuring out and navigating what's going to work best for our patients. So yes, initially, were ventilators overused? I mean, we were using a lot of ventilators. Yes. That's why I shook my head. Yes. Overused? No, because that's exactly what we had to do. And so when I talked to you in my pre-interview, again, boots on the ground, that's exactly what he's doing. Management background was, oh crap, let's have a meeting. Like, where are we at with our ventilator status throughout the house? How many CPAP machines do we have? How many V60s do we have? And looking at geographically, what are the other subsidiary hospitals? What are their needs? What are their uses? And is there a hospital that we have within our subsidiary? Because everywhere throughout the country, right, the rental companies, even to rent ventilators, were running out. So we had to come up with other means behind the scenes that a lot of the registered floor nurses didn't understand, where they're like, where the heck's management? Well, these are some of the things behind the scenes that were going on to try and provide. And so like we had subsidiaries in northern Michigan that we had to call up and say, hey, we noticed that your COVID numbers aren't, what our numbers are. Do you have excess ventilators and V60s that we can bring down to our hospital? And that's exactly what we did.
And back then too, thank goodness we had government funded research. So through the CDC, the World Health Organization, all these places were researching as the pandemic progressed to teach us what we no longer had to do or what to change to make the outcome better for the patients.
Right. So, we discussed a few of the things that was happening inside, and we will continue to do so. I first and foremost want to get the audience's reaction to a lot of what was going on. So if you'd like, you can like, comment, subscribe, and you can also email us at the Tills4Thrills podcast at gmail.com with any of this information. You can follow us on all the major social medias down there. There it goes. It's listed. With that said, there was a study that was done regarding UV exposure. Now you can get into like UVA, UVB, UVC, stuff like that. And I think UVC was used as the, Glenn, you said germicidal irradiation,
Right.
where, that's great, but it also has, you can't just be a person standing in the UVC and getting that exposure, because obviously it's bad for you. Now, what are the effects like of maybe just going outside and standing in the sun? Because I know we were popped into quarantine, right? Stay indoors, don't go out. And that was obviously to reduce transmission, which was fine. Great. Got it. But how effective would that knowledge of UV rays eradicating the virus have differed if we were able to go outside and just be like, hey man, let me just stand out, and why, I guess just in general, how would that have changed? Because obviously, like, just standing outside in the sun isn't going to cure anything.
Right, because this was carried in the blood and in the tissues. Mm-hmm. And the sunlight is not going to get into your blood, and it's not going to get into your tissues. And standing out in the sun too long is obviously going to burn your skin. It can give you skin cancer. And that was the whole thing about like tanning salons. They were trying to stay open, saying that the UVA and the UVB rays in a tanning bed would help kill the virus. First of all, the UVA and the UVB did not kill the virus, or at least at first. And the only one that actually worked was the UVC. And UVC will burn your corneas, it'll burn your skin, it'll give you skin cancer. So obviously we can't be around UVC. But being out in the sunlight, does it help? Well, the one thing it helps is your mental status, because you feel a whole lot better when you can be outside in the sun.
Right.
Also, exactly. Yeah. The other thing that makes it good, I don't think it really had anything to do with the sun health-wise, but let's say you have a positive person, positive for COVID, and a negative person outside that is standing upwind of the person that's positive, the chances of the person that's negative getting it from the positive is probably pretty low because you're outside, the wind is blowing, hopefully. And
Hopefully.
yeah. And I mean, that's going to help. Just being outside where you're not in an enclosed room is going to help. And that
Fresh
was the
ventilation.
right. And it's like if we had a COVID patient in a room, we couldn't get that patient transferred to the floor and immediately put another patient in that room,
Right.
because they're going to get COVID. It's just like the measles outbreak now. Measles outbreak, you can have a measles positive person in a room and somebody come in 3 or 4 hours later, their chances of picking up measles are really, really high.
Without
Right.
extensive cleaning.
Right.
Yes.
Without extensive cleaning.
Yeah.
So you would almost imagine at one point, right, that like obviously if you have COVID and you know there's no getting around it, you know, you have to be treated for it. But if you don't have COVID, standing outside with the air blowing, the ventilation and everything, your chances decrease of transmission of the disease. And it's kind of crazy. What were some of the sterilization techniques that you guys used inside of the ER and inside of the hospital?
Lots of bleach.
Yeah.
Right,
A whole
right.
lot of bleach. And
Yeah.
what was that
There was-
horrible gray
It was
hand?
like germicidal solution, and our turnaround times for trying to get beds cleaned were a good 45 minutes to an hour.
Mhm.
So, which, you know, then backed up the ER even longer.
Right.
And, you know, it was quite an extensive process.
So when a patient was discharged out of a room that was COVID positive, the room had to be cleaned. But before the room was even cleaned, we took a dry erase marker and wrote right on the glass of the door
Yes.
what time that patient left that room. And we had to wait 1 hour before
Yeah.
the cleaning crew could even go into that room to clean.
Was that necessarily because like it was shown that maybe the virus would die off within that hour, or
It was the virus was less virulent after an hour.
okay.
So like
So
less
your
aggressive.
chances of transmission were lower. Was it zero? Absolutely not, but it was lower.
Okay.
Right.
Because it did live on surfaces.
Right. So getting into it now, and we've talked about, you know, maybe isolating the virus and maybe, you know, quarantining and differences between going outside. One of the things that I've seen is, you know, I was supposed to go to Japan for my second contract in the military. I specifically, now it didn't end up happening. My orders ended up getting there was a mix up at the office. Something happened where I had re-enlisted for this. I was supposed to go to Japan. HRC, which is our headquarters, like our
big army.
Yeah, big army, right? Came back and was like, "Hey, man, we can't find your orders. We can't locate them. So we're gonna have to do something else." My big thing was get me out of Fort Hood. I'm tired of it. You know, it's Fort Cavazos now, but I was like, get me the fuck out of here, dog. So they were like, "Well, how do you feel about Korea?" And I was like, "I'll take it." You know.
Yeah, anything
So-
that gets me away from here.
So in my research during the COVID outbreak, right, during the pandemic, there were families in the military who were confined, right, under the guise of like quarantine. Now, they were literally just locked in a tiny apartment with their family, whether they had 1 kid, no kids, or 5 kids. And they were scheduled maybe an hour every day to go outside and stand in a small backyard that was like kind of their cage, right? They had a little fence and they had to take turns with every other family that was in the apartment building. And it's almost like, you know, they took it so seriously. It's like, hey man, for the safety of our citizens, we're going to jail them. You know, how did that look on the civilian side? Because like, I know in the army, they can force us to do certain things that we don't want to do. But on the civilian side, you know, obviously you have the ability so to speak, to say, nah, dog, I ain't doing that.
You saw all sorts of stuff. You saw, well, once it became more real and there was more news coverage, and you saw all sorts of things. You saw some people that were like, no, this is a hoax. This is ridiculous. I'm not wearing a mask. To people that were, once they finally got on board and saw family members really sick or dying, you know, to even go in the grocery store, some of the strangest contraptions they had that they thought were going to, you know, keep themselves safe. It was, I mean, I shouldn't say it was kind of funny, but it kind of was funny in the grocery store compared to what
just
we do in the
watching
hospital.
people.
Yeah,
Exactly.
watching people.
The old women's underwear mask.
Yeah. Well, I've got a friend that, true, she's a cancer victim, and I still chuckle at her because if I come over to her house to work in her yard for her, she is still wearing a cloth mask, which does nothing. She's wearing a simple surgical mask, which, okay, it'll help a little. And she wears an N95 with another surgical mask over that for me to come and be in her yard. It's truly sort of funny.
Yeah. Or people in their car. They were in their car. Nobody else in the car with them wearing masks.
Or they wear the mask under their nose.
Yes.
Like,
that's my favorite.
Like that's going to do anything for you.
Yeah. What the hell's that going to help?
Yeah.
Yeah,
You know,
no, they have the whole diaper. They have the whole diaper chin going on.
Yeah.
That was really funny because that was another thing we coined in the military was like, you know, hey man, stop doing the diaper chin thing. Just put the fucking mask on.
Yeah.
Yeah.
Well, I even shaved off my beard during that, my mustache too, because it was just an irritant, because having to wear those N95s and breathe through them,
it was horrible.
Your face was soaked all the time. And the smell of it just got to you. So we'd put thieves oil on the inside of the mask, or peppermint oil, because that's something you could get in the hospital. But anything just to help with it. And the nurses, how did they deal with it? Talking about quarantining, some of the nurses went into their family trailers, you know, travel trailers, and literally lived in the travel trailers. Most of us, and I'm not going to say all because I didn't go home with everybody, but we would get to our house and literally strip our clothes off. I mean, all clothes, start naked outside in the winter. Well, you had a garage to do it. And your shoes stayed outside. You went in through the back door, threw all of your clothes immediately into the washing machine. I used more Lysol laundry sanitizer than God ever put on earth, I think.
I used Tide with bleach.
Yeah. I mean, anything you could.
Yeah.
And then you went directly from that washing machine into the bathroom, got in the shower, rinsed off, lathered up, rinsed off, lathered up again, and then finally rinsed off so that you could get out of the shower. I don't, you know, a lot of women don't wash their hair every single day. A lot of men don't either. But there was no choice. You had to wash your hair as soon as you got home.
Because it lived on everything, right?
Yeah.
Yeah. Oh, yeah. It was terrible. And I couldn't tell you how much sanitizer every household went through. It was utterly ridiculous.
Yeah.
Oh yeah. I know that in my house we used a shit ton of sanitizer. And like we had to have family members that were like, you know, hey man, reach out to somebody because there's not enough in the stores, you know? So like we had somebody that we didn't even know who happened to be a friend of like my mom's, who sent us, because, you know, at the time we had a young child who was still in diapers. They sent us diapers, wipes, and sanitizer from California. And it was a godsend at that point. It was just like, thank you so much.
Thank you.
Yeah, there was a lot of that going on. Everybody was hoarding. They were going in the stores and buying
the toilet paper,
sanitizer wipes, hand sanitizers. They were buying toilet paper. So unfortunately, it was a snowball effect, right?
Yeah. You know, what was that? What was that? Why did they go for the toilet paper? Like seriously, because listen, man.
You need shitter tickets, man.
Well,
you know why they went for the toilet paper.
Stop and think about it. You need to wipe your ass if you don't have water.
Yeah, no kidding. So I'm like, first of all, I can't find toilet paper. Thank God for dude wipes. But then it's just like, why did they just hoard the toilet? There was points in times I would see grocery carts with like 7 different like 24 counts of toilet paper, and I'm just like, hey, yo, dog,
give me some of that shit.
Doing?
Yeah, it just perpetuated a problem because then everybody else started panicking, like, damn, I can't find toilet paper to save my ass.
Right. See some guy in the store with a doll and you're like, oh man, that's a good idea. I should stock up too.
Families would talk to each other and exchange stuff. But I think some people did it simply because they stored it up and then they would jack up the price and sell it.
Yeah.
Yeah, that's exactly what they did.
Yeah, and they were trying to make a profit off of a bad situation.
Yeah, so the funny thing about that too is right around the time that COVID was being blown up, right? Not only was there not any toilet paper on the shelves, but we also had some freak ice storms in Texas where it was like, hey man, it's snowing, everything's shut down. We don't want people out on the roads and stuff like that. But, like if you could get around, you can get around, right? Obviously, there were still establishments open, but that even added to the problem because now people are stockpiling for the winter. And it's like, what the fuck is going on? Why can't I get anything to survive? And why am I having to, number one, why am I not only, for me personally, right? Not only am I in the Army, I'm doing my time in service, and now I can't afford to provide for my family. And it became absolutely insane. So not only were people getting sick, but people were just hoarding shit. And it was just so fucked up, man.
Yeah, I think another piece was they were hoarding because they knew that the directive was not to go out in public unless you needed to. Right. So, part of that was part of the, when the surge hit and people were getting sick so fast that people were trying to just simply stock up for themselves and the rest of their family so that, okay, we're good now because we've got a surge of supply. We don't have to go to the grocery store to get, A, B, C, and D. So
one of the other things that you couldn't find anywhere was hand sanitizer of any kind. And at some point we had some distillery here that made hand sanitizer and it was out of vodka and it was
god awful.
Oh, that stuff. I don't like the smell.
You could smell it.
You could smell vodka, and that stuff stinks. So, I mean, here we all are in the ER, all smelling like vodka.
Right.
So, I mean, there's some things that we can laugh about now.
Right. So, just to kind of switch topics here a little bit. Obviously, right, COVID-19 for healthcare professionals and for really a lot of people, I think, was a extremely, extremely traumatic experience kind of going through and living through that. Obviously, right, military personnel, we all kind of use, a certain type of humor, and a lot of us kind of experience what is known as trauma bonding. What did that kind of look like for you guys in the hospital? I know that obviously, right, even staff was getting sick with this kind of stuff. So what did that kind of look like for you guys?
Go ahead.
It bonded us closer. That in the beginning and in the surge, we all came together, and I can honestly say, I've never seen and lived through a pandemic, in the healthcare system. So that was kind of my first go around. I hope I never have to go through that again. But we all just band together to do what we had to do and supported each other through the thick of it. We had nurses, like I talked about before,
right,
that once we had to declare more of a state of emergency, sometimes your union contracts about even where nurses can float to We kind of have a union contract that med-surg nurses can only go to certain floors that are more like med-surg patients. Our step-down floors only float within each step-down floor and so forth. During that state of emergency, that kind of
Goes out the window.
We try and keep it as safe as possible, don't get me wrong, but that can be put aside for, again, do the greatest good for the greatest number of people. And so we did have to redisperse some of our med-surg nurses to telefloors to partner up with some of the telemetry nurses there. And they would come down to the nursing office and check in with us, and we would have to tell them where they were going. And I would have already spoke with the floor to make sure that everybody was dispersed kind of throughout that floor to partner with, let's say, a telemetry nurse who knows how to read monitors, who knows that type of population and how to take care of them, and what's different about that population versus a med-surg population. But they came in very, scared and fearful, and, they're scared about the virus, but they're here. They showed up.
Right.
And I have never been more proud to be a nurse and to see everybody come together like that. And I cried with my nurses. I hugged my nurses. I told them, we're going to get through this together. I'm there for you. Whenever you need me, you call me. I was rounding. I was there when we needed to intubate patients, helping assist them get supplies, whatever they needed. And we had a fantastic bond. I don't know.
It's true. We all did get a whole lot closer. One of the ways, first of all, ER nurses are sick in the head in the first place.
Sure.
We all have the darkest, weirdest humor of anybody. And if our spouses heard it, they would swear that we're all having fun with each other.
Need to be instituted.
Oh, yeah, no, we have plenty of dark humor in the military where it's like we're scared to talk to civilians at to a certain degree, just because it's like, we don't want to say some weird backhanded shit and then be like, hey man, you need some help, dog. Well,
in the ER, the big joke is you're going to know your coworkers' bowel habits and sexual habits. And it's true, because if somebody says, hey, I got to go take a dump, cover me, you're going to do it. Right. And you get
at 5 o'clock every day, this guy's going to go take a dump.
Right. He's going to go do some shit. And
you just get very, very personal with each other, because you're there to hold each other up. Mm-hmm. So yes, we did get even more close than what we were, at least back then when we were so close. Yeah. But then after we would get out of work, it took forever for us to get to our cars, because we'd either sit outside or stand outside and talk with each other just to get through what was going on.
Just to try and decompress a little bit before you went home, because, a lot of us had significant others and spouses that weren't in the medical field and didn't understand.
No,
and,
sure.
We could medical speak to each other, and, you try and have those conversations with your significant others, and
they don't understand.
It's way above their heads. So, and, as traumatizing as it was for us, they wouldn't understand it. They just simply wouldn't understand.
And I used
you had to be there.
And I used to go in every day that I worked and talk with Tina or whoever else was in the office at that time, just to find out what was going on that day. Because I'm one of those employees that always showed up a minimum of an hour early, always, to find out what was going on and how could I get things prepared for the day.
Well, so, as a lifesaver, I would assume that you kind of have to put a little bit more effort into what you're doing, especially if you're so. And we're gonna get into soon we're going to get into like maybe some of the staffing shortages or obviously the misrepresentation, not misrepresentation. I would say probably just not being able to do enough. Right. So, with that said, though, like getting into the quarantine, right? So during quarantine, I was a part of what was called Task Force Truck, where we were supposed to provide humanitarian aid to people who were suffering shortages of PPE and medical supplies. And what they would do is they say, okay, cool, go stand by your truck and just stand by it all day until we get a phone call. And we would have to make sure our truck was good. We would have to make sure, our tires were good, our engine
make sure
was
that
good,
bad boy turns on.
Exactly, right. And it was already well stocked. And because it was stocked with this PPE, during the pandemic, it was considered sensitive
Mission
equipment.
essential?
Yeah, mission essential sensitive equipment, right? So it's like you look at the military and you say, like, here, these are our M4s. We don't want anybody to have them except for us, right? We would rather blow up equipment and destroy it before we let
Yep.
the enemy get it, right? So
100%.
that's how it was considered during COVID. And so we would stand by our equipment all day long. And it was stressful because we were considered essential workers and we saw everybody else getting on their video games, getting on their TVs, fucking doing whatever they're, just being able to fuck off. And they would be like in their uniform tops with their boxers on.
Right.
Calling into work.
Zoom calling. Yeah.
Calling into work and just being like, hey, I'm alive. Okay, bye. And that was it. And so we're sitting out here stressed as hell because we don't know what's going on. Not enough information is coming to us.
Right.
From either the hospitals or civilians or anybody. Right. And I remember driving home at some points, just being like, obviously not as terrible as sitting in an ER dealing with it firsthand on the front line. Right. But I would be so stressed out that I felt like I didn't have anybody to talk to about the situation because, number one, my wife, she's a civilian. She doesn't understand a whole lot that's going into the military. And I would also have to deal with my kids, and who were, babies at this point where I'm just like, I also don't want to freak out on them. So I would sit there in my car, blasting whatever music and screaming, trying to sing to it and just like getting it out. And then I'd be like, okay, cool. 15 minutes is up. Turn off the engine, go inside, hang up the jacket and be like, hey guys, I'm dad,
Right.
So I can only imagine like, on the healthcare side of things, how that felt, because now you're having to essentially, not burn your shit, but every day you have to do a procedure. Yeah, you have to do a procedure where now you have to talk to your spouse about, oh yeah, like I can't touch you right now. I have to go sanitize my whole body, my whole uniform.
Right.
Like I can't give you a hug as soon as I get home. And I can only imagine what that felt like. That's terrible.
You blow each other a kiss.
Yeah.
Literally you couldn't touch each other. You're exactly right. You had to go sterilize before you could even be around your family. And then you still prayed that you didn't catch anything while you were at work and you be a carrier and give it to your family. So yeah, it was definitely a concern.
It was very stressful with our healthcare workers. Like I said, it's not just registered nurses, it's everybody that was inside there. And there were conversations that I had with my family. I had a father that had ailing health that I felt extremely guilty about missing out on time with him. But I felt like I can't expose, my parents who are older and my father having ailing health and my mother having COPD to any potential virus. I just simply had to bow out and text them and call them or do a video call. But that didn't happen for a good month or month and a half because we were just all so busy and exhausted.
So swamped.
And I did have a conversation with my husband of, hey, I think until we know more, it's probably safer that I just sleep in the basement
Mhm.
and not try not to expose you as much. And he's like, look, I signed up for better, for worse. And I'm here. You're not going to be sleeping in the basement, which kind of freaked me out a little bit because, as you're taking care of other people and your staff and your nurses, like that's the last thing I want to think about is, what if I get my spouse sick? I'm not going to be able to take care of them too. And so there was a lot of that. And like Glenn said, yeah, you strip it down, you go right to the shower. And, like you said, sometimes there's those moments that you take in the car. We had a lot of conversations after work. We didn't get home till later because we needed to decompress and talk to each other. But there was a lot of times they went in the shower and just simply, cried to try and get it out. And, but there was a lot of times that I couldn't cry. And that had probably worse effects, a year and a half down the road for me, at least, where I had some issues after the fact. You get so busy taking care of everybody else. And then once you get through pandemics and now, nurses are leaving and other nurses are leaving, maybe not to chase agency money, but they're leaving because to hell with this. I didn't sign up for this.
Sure.
Once they got through the thick of it, you're dealing with so much that you don't have time to assess your own personal well-being and psychological well-being. And, I ended up about a year and a half later, because I went right from that to going into helping with my dad on my days off, and my sister too, and my mom dealing with it 24/7. And my mom ended up getting breast cancer and all throughout that. So I went right from one emergency mode to another emergency mode, dealing with two parents that were sick and getting through that. And then finally coming to, going to work. And I was just burnt out and didn't realize it, nor did I realize I had PTSD.
Well, and like Tina said, well, first of all, I want to back up. Remember in 2019, in December, when we were all sick, just everybody had that viral thing.
Mm-hmm.
And then in 2020, thinking back, we wondered, did we actually have it back then and didn't know?
Right.
But anyway, in January of 2020, my dad was diagnosed with lung cancer, died in July. So while we're dealing with the pandemic in the hospital, I'm having to go to the nursing home to see him. Thank God he was released from that nursing home before their first case. But here I am getting out of the hospital, having to go home and clean up, and then go over to Dad's house to take care of him. So yeah, it was a trip.
So it's kind of like a case of needing to have a blowout and not being able to have that kind of blowout.
Exactly.
Well, it's also a matter of like people didn't see that medical professionals and healthcare professionals also have a life outside of the hospital.
Right.
And it's like, hey, anything could happen with them. They don't take into account like, hey, maybe their dad is sick, or maybe their mom is sick, or maybe their brother or sister or cousin or whoever, and they don't care enough, because all they care about is my health. And you need to do something about it because this is what you're getting paid for. And it's like, bro, I got shit going on too, dog. You need to chill the fuck out.
One of the things that I think truly helped all of us nurses was, until the pandemic, I don't think people realized how much the nurse did to help their loved one.
Yeah.
And then the nurse had to be the asshole that told the family, no, I'm sorry, you can't come in and see mom, even though we know mom's going to die within the next few hours. We can't allow you in here. And of course, then that made the nurse the bad guy. But I truly think it helped the nursing profession to let people know it's the nurses that bust their ass constantly.
Right.
help
And
the people.
that's another thing I want to get into though, is I want to get into hospital restrictions and public perception, right? So we talk about the COVID virus, or we talk about the virus in general, and we talk about all the stuff you had to deal with on a day-to-day basis. And you bring up a great point talking about the nurses being the bad guy. Now I do know that there was a lot of public misconception about conspiracy theories and stuff like that because they weren't being led into hospitals to see their loved ones.
Right.
What did that look like for you guys?
Go ahead. You go first.
We value when families come in and they're there for their loved ones.
Especially at the end.
Yes. But the bottom line is, what it came down to is we are there to take care of the patient. And because this was so transmittable, like it was just creating more and more of a problem with more people getting sick if they came in and visited with their loved one. So the restrictions were put in place again for the whole public to lessen transmission to your frontline workers. But we paid a price for it too, because we don't want to restrict your loved ones from being there for their sick and ailing and dying family members.
Right.
We did the best we could. We took out our own personal cell phones to FaceTime, with the families. We brought in iPads to do the same as much as we possibly could. But, again, that created a real trauma response with our nurses too, because you're the last person there with that dying patient. And you see some of that. We're there when life is created. We're there through the sick times. We're there when life ends, but never to the extent that this pandemic brought, were we seeing death daily.
Multiple deaths
daily.
So, and just real quick on that subject, I know, Tina, in the pre-interview, we had kind of talked a little bit about, nurses during end-of-life care having to come in and hold up iPads so that, people could speak to their loved one. I mean, what the fuck does that do to a person? Because to me, at least, it kind of feels like it takes out the humanity of end-of-life care. So like, did you notice that it did something to the nurses? Well, I mean, what was it like?
Well, two things. First of all, it doesn't take the humanistic side out of it, because even though you had to tell the family you can't be here, at least you're giving them the chance. Most of the time, the patient never knew it, but to tell their family member goodbye. Now, what did it do to us? I'm a trauma nurse, so I dealt with a whole lot of death, and thank God that I had, because of trauma. But when you're seeing, 8, 9, 10 deaths a shift, it starts messing with your mind.
Yeah. Starts to get to you.
Oh, big time. And one of the things that I want to clarify real quick is, you've heard Tina and I both say the greatest good for the greatest number. That's actually a trauma disaster plan, and that's different, but it just gives the general public a good idea of why we did the things we did. We never went into true disaster mode. It was a disaster for us, but we never went into the Emergency Nurses Association's classification of a true disaster. That would be more like when the towers came down. That would be a disaster thing.
Right, exactly.
We didn't treat the pandemic that way. And the way that it made it different is like when I had said that a patient would come in with their oxygen level in the 70s. In a true disaster format, that patient would be put off to the side with somebody to hold their hand and tell them goodbye, heaven's on its way. But in our instance, it was totally different because those were the people that we saved first. So it wasn't a true disaster model, even though it was a disaster, that's for doggone sure. And having to restrict the families from coming in. At first, we didn't even know that we were supposed to keep the families away. We didn't know enough about the virus at that point. And then obviously we told families, you can come and sit in the waiting room, but you can't go to the back. Right. And why? What don't you want me to see? And
Sure.
that's where it all comes in about conspiracy crap. And then it got to the point you weren't even allowed in the door. Because if you weren't a patient that was coming in to be seen, and some lied and said they were when they weren't, but if you were not being seen in the triage to be, seen by a physician, you weren't allowed to get through the door at all.
So they're stopping people at the door.
Oh, positively, yes.
Sure.
We had to.
Yeah, we had to. There was just so many people to have to see and so many people to take care of. And as far as the end of life with the iPads and iPhones, yes, my nurses, look, I'm taking ownership. My nurses, my nurses, I'm going to say my nurses because when I'm on shift, they're my nurses, they're my responsibility, had a lot of vast emotions. They were very upset because our whole goal, most of us went into this career to help save people, help make their lives better.
Cause no harm.
And cause no harm. And when you get to a point where you've reached doing everything you can do, putting every pressor on for the patient, putting them on a ventilator, putting them on, CRT machines, and all these things, when you have exhausted all life-saving measures, it feels very defeating.
Yep.
You're very emotionally connected to that patient. You are connected to the families, and the last gift you can give them was the dignity of it, and to let them pass as peacefully as possible, and to be able to do a FaceTime or do a video call of some sort. And I'm going to say, Glenn stated, even though the patient didn't know it, I'm going to give you a different version. The last thing that goes before somebody passes is their hearing.
Yep.
So all of us felt very passionate about trying the best we could to provide that video, even though it was difficult for families.
And us.
It hopefully gave the person on the family on the other end of the phone some sort of closure or
solace. That's all you can
solace to be able to feel like at least they heard me. They knew that they weren't alone.
Right.
They weren't alone. Those nurses were in the room holding their hand.
Now, talking about conspiracy theories, one of the things that angered me, I mean, to the point of just at times screaming at the television or radio, is when you would have medical professionals and worse yet, government officials getting on television and saying, this is a hoax, the vaccination is killing people. And here we are in the trenches. We know it's not a hoax. Yeah. We're seeing it on a daily basis. And I was in the very first week of getting vaccinated. I'm sure you were too.
Yes.
Matter of fact, I think we were in the same waiting room.
Probably.
Right. So you guys are seeing on TV, right? So you guys are getting home after fighting for your lives every day and for these patients' lives, getting home, sitting down after doing your sometimes upwards of hour-long procedure when you get home so as not to transmit the virus to others and to loved ones. And you're sitting down and seeing on the TV that, a medical professional is coming on and saying, hey, this isn't real, you shouldn't worry about it. But then you show up to work for the next day and they say, hey, so-and-so just passed and they were 24 years old.
Well, we still have people that are The measles is another great example.
Yeah.
Don't get vaccinated. Well, I was vaccinated for measles how many years ago? When I hired into the hospital, I had to be revaccinated because my titers weren't high enough. And I mean, I didn't grow an extra eyeball or anything else from getting vaccinated. And I've had 6 COVID vaccinations now. And it sure hasn't hurt me. So am I going to say that nobody is going to have a reaction to any vaccination? I don't care what it's for. No, I'm not saying that. But at least try to protect yourself and try to protect the ones you love. Even if you don't give 2 hoots about your own life, do it for your loved ones.
Yeah.
Right.
So getting into that though, you know, and I don't know enough about the COVID vaccine or the booster shots or anything like that, right? Where I can give you a breakdown of whatever chemicals are in them, what kind of side effects they have in them, and everything. The one thing that I did miss during COVID was the option, right? To
Yeah,
say I
man,
don't, you know, like we, you know, the freedom to say I don't want it yet until I do my research. And unfortunately, while we were in the military, like for those who were in the military during COVID, we were forced to do so. And if you didn't get it, you got kicked the fuck out, right?
yeah, and like in a negative way too, right?
Yeah. So we would get a GOMAR, which was like, hey, you disobeyed a lawful order from like one of the highest sitting officers,
Yeah,
either in
really,
your
really
area
bad.
or in the army, which is really bad, which means like you're about to get kicked out or you can't have any career progression.
Yeah, you're cooked.
And then you know you leave and everything, and now there was a nationwide mandate, and I believe, and I could be completely wrong on this. I believe that healthcare professionals were also forced to do it as well, as far as getting the vaccine and whatnot. And you, Glenn, talked about do it for your loved ones and everything. Great, but it's also like, you know, less than 6 months or like maybe 6 months to a year after the virus took effect, and now we're dealing with this and we're in like kind of the chaos. They're just like, oh hey, by the way, we got the vaccine, come grab it. And now we're in talks of being forced with it. You have political leaders saying it's a hoax, it's this and that, and blah 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 blah. Well, you know, I'll say first and foremost, the virus is very real. I know it is. We know it is. And there's a lot of statistics on it now versus 3 years ago, where it's like, no, this shit actually happened, dog.
Yeah, and it was rough.
Yeah, and it was rough. Do I think it could have been handled a little differently? Maybe in some instances, but again, we're going back to we were wildly unprepared for this stuff. But again, going back to the vaccine, you know, I didn't know enough to where I could just be like, oh yeah, give me the jab. That's not to say that if I had done my research, I wouldn't have got it. But at the same time, I'm like, I'm being forced to do something I maybe don't want to do right now. And what did that look like on the healthcare side too? Because I mean, I would imagine that there were some people that are like, now I don't want to do it just because you're forcing me to do it.
We're both going to talk about this one. The first thing that I want to say is, whether people know it or not, the armed forces are where a lot of things are tested and where we learn a whole lot of things about trauma, because obviously the men on the front line are the trauma victims, and that's where we're going to learn new trauma methods and stuff. So the military is guinea pigs for a whole lot of things that they don't know. And I mean, when you first went into the military,
you got a whole lot of jabs.
Could you even count how many vaccinations you had?
No, dog. Let me tell you, I was going into basic training.
Yeah.
I had to do a whole bunch of push-ups. And then I walk into a room and they say, dump your pockets. You dump the pockets. They say, take off your shirt. Take off your shirt. You stand in a line, single file, one by one. And you go through a line. And it's like one person's got one, boom, left arm. Another person, right arm. Another person, left arm. Here, take these pills. Hey, take this, take that. You know, and it's like 20 times you got to fucking do it. And it's so crazy because most of those are like to prevent you from getting sick while you're in basic training, because now you have a whole bunch of different geographical locations being lumped into one. But then there's also like, you know, hey, we don't want your testosterone to get out of control because you're
Yeah,
going
the
to be locked in a
testosterone blockers.
you're going to get locked into a bunch of fucking you're going to get locked into a room with a bunch of dudes. We don't want people to start, you know, fighting and screaming and going crazy. So yeah, it was definitely a crazy time.
Yeah. Now Tina wants to talk about it.
Well, as far as the mandate, yes, they were pushing for that. Some hospitals in our area forced people. Our hospital did give us a religious opt out. But initially, I want to say I was all for getting vaccinated because, again, we just didn't know enough. However, SARS has been around for a long time. So when everybody was like, why would I get, you know, how do they miraculously have a vaccine for something that just newly came out?
Right.
It's not new. SARS has been around for a long time. What we didn't understand is, I'll speak from a personal aspect, is that virus was twisted and manipulated and mutated into something
Deadly.
Yeah.
Deadly and unrecognizable.
That was not a typical, and I'll stand on my own career here. That was not a typical SARS virus. That was manipulated, that was twisted, and it was purposely made deadly. So in the beginning, yes, I wanted that vaccine because I'm like, holy camole, this is not anything like what we've seen.
Well, and with seeing what you guys had seen already in the hospital, I can imagine that you guys are probably looking at each other going, you know, they give you the option, you know, well, not necessarily the option, right? But, you know, they say, hey, you know, listen, we have the vaccine. You guys probably turn and look at one another and go, are you getting it? Fuck yeah, I'm getting it, dude. Have you seen what's going down in the ER? Have you seen what's going on?
Well,
you know?
well, getting into the aspect of conspiracies, right? Because that's really, the political climate was so hot, right? It was just a hot thunderstorm of like, yo, man, Trump's in office, Biden's running for president, you know, elections coming up soon. And you know, it almost makes you think, because you did say, hey, this was twisted, right? And we don't have enough information from China where it was released or where, you know, the Wuhan lab that it came about, saying like, hey, they did this. We don't know if it was like an accidental leak or if somebody went into a market and just released the virus, right? And then on top of that, now we have a vaccine. Granted, yes, SARS has been around, but now you have a twisted virus where they created this vaccine so quickly. And it's like, given the political climate, given the area of launch, given the world cycle of the pandemic, given like the unpreparedness, and then all of a sudden there's some hope, it's like it kind of added to those conspiracies. And it's like, you know, just all in general, you know, I might not be like the tinfoil hat guy, and I might not like buy into everything and like believe it is reality, but at the same time, like, you know, government's charged with their people, and there's hundreds of millions of people. I'm charged with 2 people, and I lie to my kids quite often, you know, like, hey man, hey, Santa Claus is going to put some coal under your stocking when you're bad, you know? So, you know, it's kind of crazy to think, and I get it. You know, sometimes you want to be proactive in life saving and everything. Again, going back to the vaccine though, I didn't have enough research under my belt. What were some of your thoughts during it? Because I know you weren't necessarily in the environment of the military, Nick, when COVID happened. You were already like in the process of either getting out or you were already out. What were some of your takes on it?
Yeah, so for me, I was still in when COVID first came about. So a lot of what I remember was, you know, we didn't necessarily have the, you know, isolation and the, you know, I was stationed in Virginia. Virginia at a certain point had put out, you know, if you don't have to go to work, like you're not allowed to be on the roads. And that was kind of right as I was getting out. So for me personally, for an example, I got pulled over one time by a local police officer. He said, "Where are you going?" I said, "I'm going to work." And he goes, "Where do you work?" And I said, "For the United States Army." Well, where are you stationed? And
Like,
I'm like,
as you're fucking in uniform?
yeah, dude. And I'm like, yo, do you need my mother's maiden name, dude? Like, what, you know what I mean? Like, I have shit to do. I have to do this. So, there was a lot of, for us at least, there was a lot of, we started, instead of working every day, we started going to half days. And then, well, this group of people is going to come in from 09 to 1300. Then this group of people is going to come in tomorrow from 1300 to 1700.
Right.
And on the days that you're not working, you need to call your NCO, your supervisor. You need to say, "Hey, I'm alive," yada yada. They're going to talk to you about some stuff. You hang up. Also with that, we had mandatory COVID testing. That sucked. I cannot stress that enough. That was awful.
Too many brain tickles, bro.
Man, what? And it wasn't even like it wasn't necessarily like mandatory as in, hey, if you don't go get tested, we're going to kick you out of the Army. I mean, I'm sure that, some soldiers that, said, "Hey, I'm not going to do that." They were like, "Well, yeah, you are. Otherwise X, Y, and Z."
Oh, dude, speaking about the soldiers who didn't want the vaccine, right? There are videos on the internet where people were placed in the military, right? You see them in uniform and everything. They're in confinement, meaning jail, right?
Yeah. In the
and they're being held down by like 3 or 4 personnel because they refuse the vaccine. It's like, I want to be able to have that choice where they're being held down and being, stuck with the vaccine and everything. And hey, if it helps them in the future, I hope so, because I don't know the studies. I don't know, this topic wasn't well researched for the vaccine. It was researched for the trauma that was going on during the pandemic, right? With that said, I think that's wrong. You should have the freedom to be like, I don't want it. And if I die, I die, but then you should also be like, well, if I do want it, I should be able to go get it if it's available.
Right. And I think that for me personally, it's kind of the same thing, but it's also kind of it's kind of what we talked about in a previous episode, when we were talking about, the effects of alcohol and possible marijuana use in the military, where, whoa, getting crazy, guys. You see that? Shaking like butt meat. Anyways, we kind of getting into the subject here of, well, you sign that dotted line, and you need to understand that when you sign that dotted line, you're government property. And just like Glenn had said, and we all understand, they test all types of crazy shit on the military. You know what I mean? They tested, back in Vietnam, they were testing the military. Back in World War II, they were testing on the military. I believe, if I'm not mistaken, I think that Adderall, its first use was on the military just to see what it did. So for me, it's kind of a, and obviously, like I said, right, I got out way before the vaccine mandate. So, you don't have to listen to shit I say. I wasn't really there for the vaccine mandate, but I was there for the constant testing, the constant, mask this, right? And it was weird because a lot of soldiers that I talked to, we were almost so far removed from COVID. Not necessarily that, we just didn't experience it, right? Like people in the battalion had gotten COVID, people over here had gotten COVID, but it was such a smaller number. And maybe that's because I was at a smaller installation, but even the local hospitals around, we didn't hear anything at all. We didn't get any information. We weren't having people come talk to us. I mean, sure, we might have had a briefing or two, but I mean, we're not talking about a 2-hour long presentation. We're talking about a 10-minute conversation. You know what I mean? That your supervisor pulled you into a room with 2-3 other people at a time. Hey man, this is what's going on. This is deadly. You should wear your mask. If you don't wear your mask, you know what I mean? We're going to kind of jump your ass a little bit.
Oh yeah, so, and we were wildly unprepared in the military because,
for sure.
like, I mean, so from a medical standpoint, I can understand how like the ERs were getting flooded, shit like that, and but like military, we came out with briefs like, hey, apparently the apparently a new study came out. Shit's airborne. So I guess just wear your
Yeah.
mask everywhere you go, you know? Like,
Yeah.
sorry,
We
bro.
were getting new information and they go, oh yeah, it does this now. And we were like, what the fuck? You know, like it does this? You know?
Yeah. But, you know, and it was difficult, you know, and I can only imagine what it was like for healthcare professionals. So I know that in our pre-interview, Tina, you had said something about, you know, obviously you were seeing per shift, which is like a 12-hour shift, multiple deaths. And what did that look like as far as like, you know, you go from like, you know, you say Michigan, you go to New York, you go to California, you go all over the United States, hell, even all over the world. What did it look like?
Exact same way.
Yeah.
Just chaos.
Well, like we discussed earlier, on the back end from a management standpoint, you know, we had gotten to the point where we were having so many deaths that our morgue was getting
Overfull.
crowded. We had to get stackable racks in order to put loved ones in there before they would take them for the funeral homes. And again, that's the other thing, is that we didn't know enough. The transmittability was very, very high. And so a lot of times the funeral homes just simply were not taking anybody because they didn't know, you know, what the safety measures they should put in place when they go to take these type of patients. So, you know, it's not like, okay, your loved one's in our morgue for just a little bit and then the funeral home comes. It's no, they were putting the brakes on everything. So we were stacking up, just like New York was. New York got to the point of renting cooled semi trucks so that when their morgue got full, you know, they then utilized these, you know, refrigerated semi trucks to then put their bodies in. So that was kind of rough. A lot of people didn't know that inside the hospital. They just knew, you know, patients were dying, and, you know, they would have to flip their brain from being emotionally traumatized to, okay, snap out of it. Here's the next person. It's go time for the next person because here they come.
We essentially had a morgue crew.
Yeah. Where on the back side, you know, management's like, okay, you know, do we need to look into doing exactly what New York did? We had physicians kind of correlating with other physicians across the nation too, as far as care and how to change and change policies, change medications. You know, they had talked about Plaquenil at one point in time, and even our doctors, a lot of people didn't know this, but even our doctors were prescribing each other and actually taking Plaquenil to try to, you know, avoid getting the virus themselves, because they felt that that would inhibit the spike protein from attaching to the cells for them to then get infected.
Other people did that with ivermectin, which ivermectin, sorry, I'm not using that. That's a horse dewormer. So I'm not taking that drug.
Yeah. So going into it, right? You know, being in the healthcare profession for maybe as long as you guys were. I know, Glenn, you said you're retired, and Tina, you're still working. But I understand, like, you got between both of you, you have almost, if not more than at least 40 years experience in the healthcare industry. Like
that up another 10 at least.
Yeah.
So
yeah.
What I really want to know is, like, during the pandemic, not only were you wildly unprepared, but had you seen illness and death and like some of the darker side of the healthcare industry at that level before?
No, not that level.
Never. It was something like we'd never seen before. That's why I said, you know, I've been in healthcare quite a long time. And when I say healthcare, I mean, when I was 18, right out of high school, I went into volunteer for my local ambulance company. I started dispatching. I worked my way to be an EMT. So I had been out on the road all throughout going to college to be a nurse, and continued to do that for my volunteer ambulance, which I'm very proud of, through being a nurse into my 30s. You know, I'm now going on 53 years old. I'm 52. So, you know, I'd never seen anything like what this was. And I can say, yeah.
I have to agree there. Even though I had been a trauma nurse for many years and was sort of used to seeing death, I was used to seeing death from trauma patients, but not in the numbers we were seeing.
Right.
You know, it was just totally something changed about that. And I want to just jump back real quick to the vaccinations. The thing that went through my mind, and this is just a personal thing, is here I am working my ass off trying to save you people, and you refuse to even get a vaccination to try to help yourself. So it's just a coping mechanism. But what I felt internally was, okay, if you come in here and you need to be intubated or me save your ass, just stay out there and die. You know, I don't care if you don't want to get it, but why am I busting my ass and putting myself in danger when you don't care? And
right. It's almost like, hey man, you have cancer, and you know, studies have shown that this treatment works for this specific type of cancer. And then they're like, oh no, I don't want to destroy my body. And it's like, well, then okay, you're gonna die.
Well, and one of the things we heard a lot, and this is absolutely nothing against religion in any way, I'll just pray to God. Oh, I hope it works for you.
Right. Right. And
well, and again with the vaccines, okay, I'll be frank. I was all for it in the beginning because of what we were seeing. But here we are a few years later, we're starting to see some after effects from those vaccines as well. Well, we're starting to see some, like even some of the patients that have expired, they're finding huge blood clots, a lot of pulmonary embolisms, clots, big clots that have formed in the lungs, especially in the patients that have had multiple repeat vaccines. But during the COVID pandemic, we also saw a lot of microclotting going on. So those patients were clotting and having an even more difficult time, you know, breathing because, you know, their lungs were filling up with clots. So is the clotting from the virus itself?
Time will tell.
Or is the clotting that we're seeing now as a result
of the vaccine?
And so that's something from a public standpoint and a health safety standpoint that we, I hope, really dig into and really look at, because me personally now that initial strain, that first strain that was so deadly, now that that's weakened and changed along the path over the years, I chose not to continue to get revaccinated because we were starting to see so many patients coming in with pulmonary embolisms from multiple vaccines.
And that's something I want to bring up too, is people thought that if they got lucky and made it through COVID without treatment of any kind, or even if they had treatment but survived it, that they could never get it again. And that's not honestly true.
Vaccines are not meant to
totally 100% stop it from happening.
Right. So it's almost like the flu, right? So
it is a type of a flu. SARS is a flu.
Yes.
Well, what I mean is, like, when you're in the Army, yearly you have to get the flu vaccination, right?
Yes.
The problem though with that is the flu mutates at such a rapid rate that people have to use last year's numbers to account for that strain, where they give you the vaccine to protect you against last year's strain versus what it's mutated into this year. And that means you could still potentially get the flu. And so what ended up happening with me was I got the 2 shots for the COVID vaccine that it was at that time. Now, whether or not COVID is mutating at the same rate that flu is, I don't know. Not enough research again, right? Not enough research on the vaccine and the boosters. But it's like, here's one of the things I really want to get into eventually with my research on the COVID vaccine is I've been trying to have another child for 5 years now. You know, I want to have a little girl. I have 2 boys. I want to have a little girl. Now, I need to go and get myself tested to see, like, am I infertile now for some reason or whatever? And we didn't start trying to have another child until after I got vaccinated, right? And now it's just not happening. So that's kind of one of those things where it's like I've seen people that said, "Oh, I got the vaccine and now I got the shakes and I can't stop myself," and some of the stuff. I don't know how true that stuff is because obviously research has to be done, right? And it has to be done and made public. And these are you see medicines that come online and they're like, hey, this is to treat bipolar disorder, or this is to treat HIV, or this is to treat X, Y, and Z. Here are the side effects. We didn't get that with the vaccine.
And that's exactly why we need government funded research.
Yeah.
What you're bringing up right now is exactly why we have to have it.
Yeah.
Right.
It's to keep us all alive. But the one point that I wanted to make is most people thought once they had COVID, they could never get it again. Sort of like the flu. Well, no, you're not going to get that particular flu again, most likely. But anyway, the vaccinations are just made to where if you get the virus, it's probably not going to be near as bad as it would have had you not been vaccinated.
Right.
But
so it'd be in a weakened state.
Yeah, what I wanted to bring up was that between March of 2020 and December of 2022, there were 2,112,984 individuals that reported a second infection by March of 2023. Most, in other words, 203,735 had COVID-19 twice, been diagnosed. But 478 of those people had it 3 or more times. And the reason I wanted to bring that up is because we had a patient that had come in, older lady, and she had COVID, and she was put upstairs, intubated, the whole bit, and got discharged. She got lucky in her 80s that she was discharged. Came back in less than 2 weeks, again, because when she got home, the family had a big party and invited all the family in to welcome her home, and she caught it from another family member. Most likely it was a different strain, but she had it again. This happened 4 times total. The 4th time she came in, it killed her. So the belief that you can only get it once is not true either.
Yeah.
And so there were certain people that we would see multiple times. And it was just heartbreaking because, you've already had it once, you know how to prevent it. Prevent it.
Yeah.
Right. So you guys are seeing a lot of, let's call them, maybe we can call them repeat offenders or, just people that are coming in and getting this right, victims. Yeah, exactly. And they're not doing anything within their power to try to prevent, to try to mitigate, to try to, what do you think that kind of does on the nurses and stuff, and the doctors and, does that seem to take a toll too? Are there certain things that you guys remember from that?
Sure. It was frustrating. And that was one of the pieces. Again, when we made changes to be like, no, you can't come in through the emergency room. No, we're not going to have family visiting on the floor. And we did get a lot of hostile people, a lot of hostile families.
Yeah.
And I had to deal with a lot. Our lives were being threatened. Like, don't tell me. And I've got me and my buddies that are going to meet you out in the parking lot.
Our lives were threatened more than once. Security having to escort people out. Police had to be called more than once.
Yeah.
And it was because we had to be the bearers of bad news. I guess I'll put it that way.
Well, there had to be a stop gate somewhere because we were getting such influx, and we had to be able to focus on the patient. we had to be able to focus on the patient and the families. You know, when your emotions are high, you know, yes, they're concerned about their loved one, but they're not understanding that them not visiting is putting their loved one first.
Right.
And we understood that. So the culture that shifted inside the hospital was, you know, we did get a lot of threats. We did get a lot of irate family members. But on the other aspect, it was kind of a sigh of relief when the hospital finally did say no more family visiting. We were like, thank you, Jesus, because like it's enough to have to, you know, focus on what I'm doing than worrying about families in and out, and then them going, hey, you know, I haven't had lunch today. Can you order me a family tray? I'm like, are you
Jesus.
You're like,
serious?
what kind of shit is that?
I'm concerned about making sure your loved one's being cared for, and you want a family tray, or you need some ice water. Do you? You know, it's that part.
Yeah.
Was a lot.
Yeah,
frustrating.
well, because they're not even the patient in question. They're just like,
Right.
hey, bro, do your job and get me something. It's like, hey, go fuck off, dog. But
Yeah,
before
me, waitress.
yeah, before we start wrapping up here, because we are coming up on almost 2 hours, I do want to get into a little bit of the you know, coping mechanisms. I know we talked about it a little earlier, where it's like, hey man, you're gonna work in an ER, you gotta have a dark sense of humor. And it's almost like the military, where
you gotta be a little fucked up, you know.
Yeah, we say some off the wall shit, and if civilians saw it, they'd be like, hey man, you're broken, go fix yourself.
Yeah, hey, lock that dude up.
Yeah, and you know, because listen, man, me and my homies, you know, me and Nick, we've talked about some dark shit.
We say some crazy shit.
And you know, if we said it to the public, they'd just be like, are you sure you're okay? And it's like, oh nah, bro, it's a coping mechanism.
Yeah.
Like after I say it, I feel better. You know?
Yeah.
Well, there were some nurses that, the ones that typically went to a bar and talked after work, now they went to the bar and stayed for hours.
Yeah.
Right.
That personally wasn't my escape. My escape was, you know, calling Tina and, you know, calling friends that actually understood, talking to nurses that worked in other cities. You know, that was my coping mechanism.
Yeah.
And sometimes sitting alone and crying.
Yeah.
Yeah. I can honestly say the dark humor on a normal work day, we have a lot of that. Okay. On a normal, you know, circumstances.
On a good day.
You know, I mean, you know, there have been songs like that people sing, like, you know, another one bites the dust kind of thing. But during the pandemic, because there was so much of that going on, you know, the dark humor and trying to be, you know, release stress that way, really it wasn't. There was a lot of more somberness. And the way we relieved the stress was exactly like, I mean, a lot of people did it probably in an unhealthy way of going to the bars or going home and drinking. Sure. Most of us just talked to each other. Yep. The hospital did institute, they handed out cards, and we had our psychologists and psychiatrists, you know, kind of on standby and on call so that they could, you know, decompress that way and talk to someone. But I'll be honest, I don't know a ton of people that utilize Dr. Franklin and you know, people in that area, because
like
we were
the
just
psychologist.
So tired. We were just so tired by the end of the day. It was exhausting.
Yeah, you didn't want to sit and discuss with somebody that was going to try to talk you down.
Yeah.
No, you wanted to discuss your day with people that knew what the fuck you'd just gone through.
Yeah.
Right. It's almost like misery loves company, where you're just like, you know, hey man, like we've been through the shit, like whatever, we're trauma bonded, we're gonna fucking talk about it. And you know, there was points and times in the military where we'd just be like, because it was so stressful having to deal with what we needed to do during COVID, that it was like we would take down our masks, and we'd just be, hey, bro, cough into my face right now. Like, send me home. It's like, send me home, dog, because I don't want to be here. I want to
lick
fucking
my
go,
face or
I
stuff
want to
like
go
that.
fucking die in a dark corner somewhere. And it's just like, hey, bro, fucking chill out,
Yeah.
Well, we'd get behind the nurse's station and pull our mask down just to get some fresh air,
Right.
because we were sick and tired of smelling our own breath. So we'd get behind the nurse's station, pull our mask down. If anybody came through that was from management, we'd put them back up.
Yeah, shoot them up real quick.
Oh yeah.
Yeah. So right. So I'm glad that it had kind of been brought up already, but I was going to ask the question that you had kind of already answered. The question I was going to ask was, did the hospitals kind of provide you guys with any types of assistance at all? I mean, yeah, they brought in like the psychiatrist or the psychologist, and but was there any other kind of effort made by the hospital, or was there anything else that the hospitals could really do for you guys?
They actually tried in their manner. I can't frickin' stand pizza, because all we got, the way we looked at it, the only thing we ever got was frickin' nasty ass pizza.
So you guys were dealing with an outbreak, and they go,
well,
how do you guys feel about Little Caesars?
Exactly. It was their way of saying
pizza party, raise morale.
Their way of saying thank you.
Yeah.
But our way was saying shove it up your ass, because we're tired of damn pizza. Get us a sandwich, get us a Coca-Cola, get us something besides a damn pizza. They also, excuse me, they also set up little rooms
that was very nice.
What the heck was the name of those rooms? They called them something.
Oh, isn't that terrible?
A decompression anyway. I mean,
a freak out room.
Meditation room. That was it.
Yeah, so it's a room where you can go have a blowout. Yeah.
Well, what was funny about it is none of us had any freaking time to go.
Yeah.
It was meant to be soothing.
Yes, and it was.
They had like salt lamps, and some floors, family members being so thankful. There was people that bought massage chairs, so they would put it in there. But again, in the height of it all, who had time for that?
Yeah, you don't have time to go do that.
I mean, that's great, but we weren't using it.
Right.
Wow. It's almost, man, I wish we had a meditation room during my time in service, because we didn't get that opportunity. So, what's really funny though is
we got the motor pool.
No, we have what's called the E4 Mafia.
Yeah,
right?
the old mafia
about that.
The sham shield.
The sham shield, right? So there was a guy who was speaking on it, and he was talking about what the E4 Mafia is, right? And one of the big no-nos is you don't talk about it, because it ain't a war crime the first time. You know what I'm saying? Rubber Ducky Squad. This guy would literally take a clipboard, put a piece of paper on it, and just walk with the highest sense of purpose. And he'd throw himself into a janitor's closet, and just, nobody would stop him. They'd be like, oh, this guy's on a mission. He's doing something important. This guy would lock himself in a janitor's closet and fall asleep for like 45 minutes at a time. Yeah. So you want to talk about shammers? Hey, shit's real.
I'd hate to know how many cigarettes I smoked during COVID.
Yeah.
Oh my God.
Was it?
Yeah, dude.
Was it kind of one of those things where you would get done with a patient, you'd have to go burn a cigarette, and then you'd come back to a patient and have to burn another cigarette? Like, was it just that stressful?
We weren't allowed to get that many breaks. It's just, if you got the chance to where you could run and hide, you were supposed to go off property to smoke. Kiss my ass. We never went that far.
Right. Yeah.
Because you didn't have time. You couldn't go that far away. And at least where we were going, somebody could run out the door and holler at you and you'd hear them.
Right.
But, and it wasn't so much while I was at work, but from the time that I left the hospital until I got home, it was 24.5 minutes, even though I lived 30 something miles away. But I would have 5 or 6 cigarettes in that little bit of time.
Oh yeah.
Just decompress.
Or like or
And
like
he
maybe
had actually quit for some time.
10 years. I've been quit for 10 years.
I was going to say, he had been to the point where he wasn't a smoker anymore, but just again, the stress and the emotional trauma of what everybody was going through, like his nerves were shot. And nobody said boo about that because, hey, you got to do what you got to do to get through it. But again, I asked him when you asked us to come on here and we were talking, I said, just out of curiosity, now that you've been retired and out of the hospital, like, do you, again, getting into the kind of the after effects, the PTSD, I'm like, do you still dream about or think about some of the things in the hospital?
Like not being able to care for all the patients that you're looking at that moment? Yep.
Yeah.
Still
like you almost wake up in a night sweat kind of thing.
No, I don't have night terrors from it. Not like true PTSD, but it's just dreams about I have more patients than I can take care of.
Oh, okay.
Do
yeah.
you
and call lights and call bells or ventilators ringing and
do you guys get like a lot of those like extremely intrusive thoughts where you'll be thinking you might be gardening or doing whatever you're doing, and then all of a sudden you just like are in your mind at least taken back to that time? Or
nope, that's why I garden.
right.
So I know for me personally, right? I have this weird thing, it's undiagnosed. I don't know what it is, but like
Autism.
No,
I'm just kidding.
Probably no. Like I could be completely calm and just sitting down, not moving around, not doing nothing, and all of a sudden my heart will start beating out of my chest. My my eyes open wide, so I'm just like, fuck, what's going on? And then like it'll go away. But then it's like, why did that happen? It's almost like when I got diagnosed with my sciatica and stuff like that, right? So it started with I had a serious back spasm, and then I asked my doctor. I was like, and I probably could have handled it a little better because like I kind of went off on this guy, but he was like, "Oh yeah, you had a back spasm," and I was like, "Okay, cool. Why?" And then he was like, "Oh, it just happens." I was like, "Nah, dog, that shit hurt. Like I couldn't move. I couldn't.
Yeah, I never
function,
been in that type of pain before.
And I was like so when I got it, I was inside of a container, and like I had to put myself up against the wall and squat, which was painful for my legs already and my back. And I was just like, oh, I can't move. Like this is what I'm doing now. I'm stuck. And my NCO at the time, my supervisor was just like, "What are you doing, dog?" And I was like, "Dog, I can't move. Like I am in pain." And he thought I was being a shitbag, and he was just like, "Dude, get to work. Or if it's that painful, just go to the hospital, dog. Like, what are you doing?" I was like, "Motherfucker, I would if I could. I can't move right now. Fuck off." You know,
I can't move an inch.
But it's just funny story. But getting back into it, going as far as the stressors are, man, I found myself going from like I smoked maybe half a pack a day to when COVID hit, just because of the stressors on the military side of things, I was smoking a pack and a half a day. I started chain smoking because I was like, I can't deal with this fucking stress. And then now it's like I'm super anxious, I'm super anxietal, I have constant frequent panic attacks. I have anxiety attacks where I'm just like, one little thing in my day changes and I'm freaking the fuck out, figuring out, okay, cool, how do I fix this, right? And so I can only imagine what it's like for somebody who was on the front lines in the hospitals dealing with that kind of stuff and thinking about the people that they couldn't save.
Well, again, and I wasn't at the bedside 24/7. I would run to the codes, help with those, maybe help intubate, putting a tube down somebody's throat, figuring out a way, okay, is there a unit bed, get them to the unit and on to the next thing. So I don't have, the stressors that my ICU or my ER nurses had. But I had my own certain stressors as well, and trying to figure out how am I going to staff these floors? You know, my nurses are sick. Okay, this nurse is out for 5 days or 7 days because they've got COVID, or, you know, we've lost some nurses, and, you know, how am I going to make this? You know, I'm one person trying to figure out the staffing for the whole hospital. Like, how am I going to make this work? So kind of the after effects of that for me, and then taking care of my parents after the fact, you know, I got to the point where I felt like at the time that my leadership wasn't as supportive as they should have and could have been, and weren't as, they weren't out there on the floors. They weren't
as involved.
They weren't being visual. They
didn't even
helping,
show up in the hospital.
you know? And so I felt like, damn, this is put all on our shoulders. And then after, so like it was like a year and a half. And like, once we got through all those surges, we started seeing nurses say, screw this, I'm going to go chase the money. They're offering like $110 an hour, like CRNA wages, to go work in this hospital or work in that hospital. So like the after effects of all this, getting through it, was now we've started to lose nurses, and now I'm having an even more difficult time staffing. And I just felt like the leadership at the time, you know, they're just like, figure it out. And we did. And then we started losing, you know, we started losing supervisors, and you couldn't take any time off. And so I had gotten to the point where I was so stressed that I developed that negative mentality too, like, screw this. Why am I doing this? Like, I just need to get a break. I need to get away. And I think if I would have felt like I could have taken time off, or actually had a mental health break for a few months, I probably could have reset myself to not leave. So I did leave the hospital for about 3 months. I had no plan. I freaked out because I hadn't had time to grieve my father's death. I hadn't had time to process going from one set of emergencies from a pandemic to now a staffing crisis to, you know, any of it. I didn't have time to process any of it. So when I left, like, I was doing some crazy things that I didn't even understand or notice. In my sleep, I was kicking, I was screaming, punching. Like, my husband had to tell me, like, I was doing all these things leading up to me leaving.
That's PTSD.
And okay. And so, and we would be driving in a car, and he would be driving, and I'd see something out of the corner of my eye, and I'd be like, oh! Like, you know, I would immediately go into panic mode, and my pulse was racing.
That shit is real.
Catching my breath. And I was like, what the hell is going on? And so when I left, like, it literally took me the full 2.5, 3 months to finally get my heart rate under control, and just on a normal basis, to not kick and scream in the middle of the night, to not grind my teeth, to not wake up with headaches, to not hear call lights, you know, or ventilator alarms in my sleep. To, you know, to not dream about doing CPR on somebody, or putting somebody in the morgue. And it took a long time. You know, I realized after a few weeks of being home that I was going through PTSD. And again, I didn't feel that I could take the time off because there was nobody there to take over for you.
They needed you.
And so, and I'll tell you this piece, and I'll kind of end with this, that I had so much paid time off hours in my bank because I was dedicated enough to my patients, to my staff, that I didn't take time off. And I was always coming in to try and help out. that I had so much time off in my bank that when I left, I got a check for over $9,000 because, and that's after taxes, because of how much paid off time that I never took. And I think mental health is so important in any job, in any phase of life, that there has to be some work-life balance. So yes, it's great to have those vacation hours. You need to have a good PTO bank in case something happens, in case you get sick or your loved ones get sick. So don't drain it down to zero. But on the flip side, it's really, really important, especially when you go through a pandemic or you go through something, to have somebody to talk to have time off to decompress, and to put your mental health as a priority.
Right. No, absolutely. You know, I went through something similar where it was like I didn't take the days off that I needed. So in the military, you get like 30 days a year to take time off, but you can't take those 30 days at once, right? And so once it goes past, you have 60 days of leave, you either use them or you lose
it.
right? And you don't get paid for it, you know. So I mean, you get paid, like, obviously when you take the leave when you're in the military, you get paid to be like, hey, you know, you're still receiving that paycheck, just continue, you know, carry on, do what you're doing. You know, you take 5 days of leave, you could take 3 days of leave, you could take 2 weeks of leave at a time, but anything over 30 days you have to get approved from like way higher, right? But I always had so many days of leave, and during COVID it got extended because we weren't allowed to take the leave. It was like, you know, it got extended because we had to show up to work, we had to do all these things, we had to, you know, go here, go there, fucking who's monkey fucking the football and saying what we got to do today. So when I finally did take leave, I took 29 days because I could get that approved easier than I could 30 days. And that first break was just such a reprieve. But even then I was still freaking out because I was like, now I just don't know what I'm doing with my hands, you know. With that said, I want to say thank you so much for taking the time to come on and discuss this stuff with us. And I really hope that in talking about this, it hasn't, like, you know, reactivated something to cause those stressors anymore. You know, it's kind of wild to think about because you can completely forget about something and come back to it and revisit that and start that process all over again. And mental health is so important that it needs to be addressed for the individual so that the individual can heal. We are going to come to a close though. And before we do, I want to ask Glenn, because I know Tina, you were able to say some final statements on that. Before we end, I do want to ask if Glenn has any closing statements to say.
You're exactly right that mental health is a huge issue, and that's what the COVID pandemic did to all nurses. I can't imagine any nurse that didn't have it. When I retired, going on 3 years ago now, not taking time off is something I did just like Tina. I had 536 hours of PTO time.
Oh, wow.
Crazy.
And I mean, it's lunacy. I just never left. My life was dedicated to that hospital. And take care of your mental health. If you need to talk to somebody and a friend is enough, go seek professional help.
Absolutely.
Positively do it, because you've got to do it for yourself. And actually talking about this, it didn't bring back bad memories for me at all. I'm hoping it helps somebody else.
Yeah.
Understand what people went through on the other side.
Yeah. And to teach nurses moving forward, really, again, you know, take care of each other. You know, you're all in it together. Don't put each other down. You know, we're here to work as a team for the benefit of the patients. That's why we went into this. But to learn to have that work-life balance, you know, it's important. it's important to take the time.
Exactly.
No, absolutely, 100%. It's just absolutely important to be able to recollect your thoughts, recollect yourself, find out again who you are. Because when you get tasked with the mission, you know, and the mission has to come first, it's almost like you lose a sense of who you are because you're fighting for this purpose. And then
Right.
when you get that downtime, you got to restructure yourself to figure out exactly, you know, what comes first for me. You know, is it my family? Is it my job? Is it my mission? Is it whatever? And you know, you have to fight through that a lot of the times because it gets jarbled up in your head and everything gets mixed and tossed around. It's like there's days where I would come home and I was so tired that I wouldn't even change out of my uniform. But because I have to be somebody specific while I'm in my uniform, that's how I acted while I was home. And I had to take a long look at myself in the mirror and realize this is not who I like to be. This is not, I don't like what I'm becoming, you know, and it really gets kind of fucked up. But with that said, again, thank you so much for coming on to the show. We are going to end it here. To the audience, if you have any thoughts, questions, comments, concerns, you can always email us at the Tills4Thrills podcast at gmail.com. Of course, hit that like button, subscribe, bell icon for notifications, comment down below what you think. You can also follow us on every other major social media platform. And before we go, I'm going to go ahead and throw it to Nick to see if he's got anything to say.
Hey, how's it going, guys? Thank you for joining us on this week's episode of the podcast. You know, obviously great information that's coming in and coming out, right? Just like we've reiterated before on previous episodes, if you're a veteran and you need something and you need to talk to somebody and you're struggling through some things and you don't know who to talk to, you can always dial the Veterans Crisis Line, dial 988 and press 1. And I think anything other than that, we'll go ahead and catch you in the next episode. Bye-bye!